Alright, here we have the femurs. We got a left femur and we got a right femur. And they both have the same structure, so I'll just go over one side and I'll choose the right femur. Okay. Now the femur is the longest and heaviest bone in your body, and it's also the only bone of your thigh. And in terms of the structure of the femur, we can start here at the top with the head of the femur. Now the head of the femur has a very special depression here known as the fovea capitis. And the fovea capitis is actually where the ligament attaches from your head of the femur to the acetabulum of your hip bone, okay? And that's where the femur articulates with the hip bone or pelvic bone. If we go down the head of the femur, we reach the neck of the femur, okay? And just next to the neck of the femur, we have two processes here. We have the greater trochanter and the lesser trochanter, okay? So these are the two trochanters. And in between the two trochanters, on the anterior surface, we have this line called the intertrochanteric line, intertrochanteric between the trochanters, intertrochanteric line. And on the posterior, those two are separated by this ridge known as the intertrochanteric crest, okay? And the intertrochanteric crest and the intertrochanteric line are also sort of what separates the neck of the femur from the shaft of the femur. And what's interesting about the shaft of the femur is that if we turn it around to the posterior, you can see this rough line running down the length of the femur. This is called the linea aspera. Linea aspera meaning rough line. And if we look up top, you can see a line branching off from the linea aspera. It's a very faint line. This is called the spiral line. And just on the opposite side, toward the lateral end, you can see a rough surface. This rough surface is known as the gluteal tuberosity, okay? Because this is going to actually be the point of muscle attachment for your gluteus maximus, your butt muscles. So that's where they attach. And anytime you see a tuberosity, you can make a safe bet that that's going to be an attachment point for muscle. Going down the length of the femur, we can see the linea aspera branches off into two lines. These two lines are called the supracondylar lines. Supracondylar, supra meaning above, condylar referring to the condyles. So these lines are above the condyles, and we'll get to the condyles in just a second. So these are the supracondylar lines. On the lateral side of the femur, we have the lateral supracondylar line. On the medial side of the femur, we have the medial supracondylar line, okay? Lateral meaning away from the center of your body. Medial referring to more close to the midline of your body. And if we follow the supracondylar lines downward, we are met with the epicondyles, okay? The lateral epicondyle and the medial epicondyle. And if we flip it around, look at the posterior, we see the condyles. We have the medial condyle and the lateral condyle, and just in between those is this depression. This depression is referred to as the intercondylar fascia. Intercondylar, between the condyles, fascia because depression. Alright, and just superior to the intercondylar fascia, we have this region here, and it's also right between the supracondylar lines. This region is referred to as the popliteal surface, okay? Now if you look very closely, right by the medial condyle, we have this triangular process here. This triangular process is known as the adductor tubercle, and the adductor tubercle is actually going to serve as one of the points of attachment for the adductor muscles in your leg. Okay? Now, in terms of figuring out, okay, we have a femur, right? We have a femur, but which way does it go? Does it go this way, or does it go this way? How can we tell? Well, one tip to figure out if we have a left or right femur is to look for the linea aspera. The linea aspera, if you remember, is that very rough line running down the length of the femur. And this line should always be on the posterior surface of the femur, okay? And so when you get a femur, look for the linea aspera, and that's going to be the posterior surface. So do we see the rough line here? No? Okay, flip it over, and now we see the linea aspera. So we know this is the posterior surface, and we know that it goes like this on your body, okay? And you can use yourself as a cheat sheet. You can use yourself as a cheat sheet, place the bone on your body, and you know that that looks right. And so now we know this is for sure a right femur. And in terms of bony structures of the femur, that's really all there is to it.